Well, ADHD is an interesting field. I am um, in the adult medicine and adult psychiatry. So a lot of times ADHD is considered just a childhood illness. And I became interested in it because I was serving patients in various clinics, and I began to notice that a lot of them that were suffering from other diagnosed conditions were really actually started with this condition. So ADHD, in my definition, is a neurological and developmental disorder that has its roots in childhood. It's a genetically based illness that is modified, like many other conditions, by environment and in utero exposure. And so it's a very complex kind of a condition. And by the time I see patients in this office, they're not run-of-the-mill one type of a disorder. A lot of my work involves actually sorting out various conditions. That's not the only thing I treat. I treat anything that is within the purview of general medicine and psychiatry and behavioral medicine. But the ADHD is a special interest because of that. Well, there are very complex, again, diagnostic challenges and criteria. And I think one of the mistakes that the people make, and sometimes even physicians make, is that this is one of those conditions that you just take a checklist. And it's not uncommon that we see patients that they found a 6 questionnaire or 18 questionnaire or even longer or shorter online, and they come in and say that they have ADHD. And that really doesn't mean anything other than the fact that they've notified themselves of some issues that they've had. And then our job is then to sort out, to do a differential diagnosis. But the core symptoms of ADHD developmentally is that an inhibition regarding attentional sustainability, and then also hyperactivity. And so along with that comes a whole other set of things, including being impulsive, not being able to pay attention to sustained tasks. And again, historically, it's really important as part of the medical history taking that you trace back these symptoms to childhood. How they extend into adulthood, that's a whole